So I wanted to welcome you all to our little info session today on the mentoring process for the Wallace Awards. Um, this is an informal session, but before we get into it, I wanted to introduce myself. My name is Michael Luella. I'm the manager for the Office of Community Engagement, and I'm being joined by the director of our office here, Louis Shackelford. Louis, would you like to say hello?
Hello, everyone. Thank you for joining us today. As it was said, my name is Louis Shackelford, he, him pronouns. I am the director of the Office of Community Engagement here at the UW Fred Hutch CFAR. So happy to have this conversation with you all today.
Awesome. And also joining us is Kashette Ronan. And Kashette, would you like to introduce yourself?
Hi, everyone. My name's Keshet Ronan. I use she, or they pronouns, and I am a faculty member in the developmental core in the Center for AIDS Research.
Beautiful. Thank you. And so we are working under the auspices of the Office of Community Engagement, which is a program here under the CFAR that's trying to provide leadership and support to the UW Fred Hutch CFAR community and our broader local communities to support effective and responsive HIV-related science. We're really seeking to develop and enhance and sustain those bi-directional relationships between researchers and community. And this means often we are advocating for meaningful involvement of communities in the design, implementation, and dissemination of research, as well as building capacity among CFAR researchers to work with community. And this is all in the name of creating better HIV science. And most of our programs focus right now around our community consultative group, which are paid consultants that help us do our work. You'll see in the lower right, what we're really doing a lot lately is research reviews, including we'll be doing the reviews for the Wallace Awards. And we used to have a lot of ad hoc working groups, the stigma working group. There was also a young Black men who have sex with men group at one time. And we don't have any current groups going on. And so I'm going to turn it over to Kashette to do an overview of the Wallace Awards.
Thanks, Michael. So the Wallace Awards are named for Dr. Stephaun Elite Wallace, who was a scientist, social justice advocate, and leader in the LGBTQIA+ ballroom community in the Seattle area, and really a champion of community-led research. This award was really his vision, and the award wouldn't be possible without his staunch advocacy. And so this award is named in loving memory of him. So the goal of this award is to grow capacity for community-led HIV research with funding, mentoring, and educational support for community leaders. It seeks to facilitate connections and collaborations between community-based organizations in Washington State and members of the UW Fred Hutch CFAR. So applicants are eligible to apply for the Wallace Awards if they're actively involved in and have a strong commitment to community-based HIV work in Washington State. They need to be employees of the organization that is receiving the Wallace Award. So the funding actually goes to an organization. It doesn't go to individuals. And if they're not an employee, then they have to have, a longstanding relationship with that organization. This award is not intended for people who are already working as highly research trained researchers. So applicants are eligible if they have a high school diploma or GED, associate's degree, professional certifications, bachelor's or master's degree, but they are ineligible if they have a PhD, JD, or MD, or if they're currently an HIV investigator. Employees of CFAR institutions are also ineligible. So the Wallace Awards are $5,000 to $20,000 per award for 1 to 2 years, depending on the complexity and scope and duration of the work. So this is a timeline of the application process. So by May 30th, applicants need to submit a non-binding letter of intent. By June 30th, we will match them with a mentor. And then between June 30th and August 31st, they're expected to have 3 consultations, one with the OCE, one with the Data Science and Methods Core, and one on budget. And the final application deadline is November 1st, 2024. We expect reviews to take place in January and the award period to be January 2025 to December 2027. Now I'll hand over to Lewis. I think you're muted.
Oops, can you hear me now?
Yeah.
Yes.
All right, so I'm going to talk to you all today about the types of projects that we expect to be undertaking by folks that apply and are accepted for the Wallace Awards. So there are 2 traditional types of projects that we're looking at, or 2 types of projects that we're looking at. The first is traditional projects with focus on biomedical interventions, basic science, clinical, epidemiological, social behavioral, and implementation science research. So these are projects that we know as traditional research, and which you will be most likely most familiar with. But one of the things that makes the Wallace Awards really unique is we also have a focus on non-traditional projects. So these may be projects that are not immediately identifiable as typical research as we think about it, but they do contribute to the overall understanding of the HIV epidemic or communities disproportionately impacted by the HIV epidemic that gets us closer to doing better science. So this is any sort of projects that contribute to the overall knowledge and understanding of HIV science or service implementation, offer vital support to both HIV research initiatives, researchers, or research participants themselves, enhances the capacity for conducting HIV-related research or establishing collaborative efforts, expands the scope of who is involved in conducting research, notably incorporating members from underrepresented communities affected by HIV, and prioritizes the interests and issues critical to the community. So just a few examples of what these types of projects will look like. This slide really focuses on majority of projects here listed here are more traditional. So enhancing PrEP or treatment as prevention uptake in priority populations, uncovering factors that can increase HIV testing, understanding and developing tools to address HIV vaccine hesitancy. So these are things that would probably fall more in that traditional category. Whereas on this slide, we have some examples of what we would consider more non-traditional projects. So simplifying complex scholarly articles for broader public consumption, organizing workshops to equip individuals with essential research skills, understanding facilitators and barriers to medication adherence. So these are all things, all projects that will help us to better implement HIV services and help better the science overall. And continuing some other types of projects, creating community-friendly research materials or social media platforms, executing community surveys, focus groups, or qualitative interviews to gather firsthand data. So really just opening up the scope of what people think research can be so that we can bring more people into the research space, particularly those who have traditionally been excluded or marginalized in research, and bringing their ideas to the forefront to get a sense of what does the community think we need? What's a good question that comes straight from community that helps us do better science? So moving on, I want to talk more now about mentorship in the Wallace Awards. This is primarily what we wanted to talk to you all about today is what does mentorship look like in the Wallace Awards? So an important hallmark of the program will be mentorship. Community investigators will receive mentorship from academic researchers in preparing and executing their proposals. Why? It's the purpose of this mentorship aspect of the program is to grow the capacity for local community-led HIV research. We know that there are strong ideas and strong community leaders throughout various groups throughout the area that the CFAR serves. We want to make sure that they are equipped to move forward in the research space, which we expect them to have the community expertise, but having the research expertise may not be as readily available to these folks. So who can serve as a mentor? Academic mentors must be appointed at a US-based affiliate of the UW Fred Hutch CFAR and the University of Washington Fred Hutch Seattle Children's Access to Advanced Health Institute, University of Hawaii. So self-explanatory. So how will mentors be matched with community investigators? So the Wallace Awards team, which is led by the folks you see here on this call, will facilitate matching of community investigators and academic mentors at the time of application based on the community investigators intake questionnaire. So it's really important to fill out that questionnaire so we know where your expertise lies and we know which type of projects would be best to match you with. And so mentors will be matched based on the goals of the proposed project, specific areas the applicant identifies for as a mentorship need, and additional mentorship preferences stated by the community investigator. So the community investigators are also welcome to select a mentor provided they meet the qualifications described above. So really the community is guiding this process in terms of who would be the best mentor for them. We view, and this is one of the key important factors that we wanted to talk about today. So we view mentorship as non-hierarchical, shared learning that is guided by the needs of the mentee. So what does that mean? It means that it's not about dominating or telling someone this is how you're going to do your project, this is going to be your approach. It really is about a collaborative, shared experience, a partnership, if you will, a working partnership where two people on an equal standing come together and figure out the best way to move a particular project forward, or come together to do some shared problem solving with both having equal weight of ideas and concepts put on the table. So it's critical that mentors listen carefully to the specific needs of mentees to meet those needs without making assumptions about the mentee's specific needs, abilities, and goals. And again, it's important to understand that the folks coming in may have tons of experience in community, tons of experience about how to best engage and deliver services to community, but may not have the research expertise in terms of how to fill out a particular form or how to apply for this grant. And that's where the synergy between the academic researcher and the community really will shine. So our hope is that mentors schedule an initial meeting with the mentee once they have been matched. We hope that this happens between May 30th and June 30th. That's our timeline. At this meeting, the mentor and the mentee should complete a mentoring agreement that describes the expectations and goals for the mentoring relationship. So to support, so one of the things that, and this is just going through different aspects of the mentorship relationship as we see it. Ultimately, it will be up to the mentor and mentee, but some of the parameters that we see as really important in this process is the support for the grant application process. So depending on the mentee's needs, this may include writing a required letter to support the grant, ensuring that the applicant completes required pre-submission consultations, support in refining and scoping research questions, really helping somebody to navigate the grant application process. Next slide. Another thing we expect and we just want to foot stomp is just sharing examples of grant applications. It's also something, templates, reviewing and suggesting edits. It's expected that several meetings will be needed during this process, and answering questions as well about the application process. And then we anticipate that research-specific sections of the grant may need particular support, such as data analysis, human subjects, protections, budget justifications, and results disseminations. Another aspect of the mentoring relationship that we think is important is the support for project implementation. So supporting IRB, things like the IRB application, demystifying and supporting the preparation of materials for NIH clearance, connecting Investigator with the Wallace Awards team, if they request additional professional development, really just helping somebody understand how to navigate this process. Again, very similar to the grant application process. And of course, to advise the mentee during the period of grant application and implementation on professional development questions, and connect them with training and resources available through the CFAR and or other resources the mentee is aware of. Some of this will be provided by us as well. We plan to make available a list of resources that an awardee will have available to them after they receive their award through the CFAR. So these are resources that they can partake in through the CFAR. So hopefully that will help in this process as well. So the biggest thing we want to say is that the goal of this mentorship relationship is to help shepherd someone through a very complex process, and really to learn, for the community member to learn and the mentee to guide. We're not asking you to do anybody's work. We're not asking you to directly perform any of the project activities that may be involved in the Wallace Awards, determine the scope or focus of these projects, determine any priority populations, participate in any implementation, or make any final decisions about the planning and implementation or results of the research project. This is about the community member learning how to walk, and the mentor helping to shepherd them along the way, just kind of holding their hand, but not walking for them. And it's also really key that mentors know that they will not receive any salary support for their participation as a mentor in the Wallace Awards. Okay, I kind of touched on this earlier. The CFAR, particularly the OCE team, will provide resources to support the mentoring relationship, including providing examples of mentoring agreements.
And there's my contact information. When we say to contact the Wallace Award teams, you can send me an email, or if you want to call me on Mondays, I'm in the office. You can also send an email to the cfroce@uw.edu email, but sending one directly to me will trigger the actions that we need to get started around whatever the question or the situation is that comes up. And so that's our presentation. So it's now time for any questions that people had that they wanted to discuss about this mentoring relationship.
I'd like to ask a question, if I could, about the IRB submissions, just because my understanding, if someone isn't a UW student or employee, that they can't submit to the UW IRB. So the last project that I did with an organization, it went through me with an agreement from the organization that they would, or that the IRB would allow the umbrella approval. So is that the expectation if someone isn't? Yeah, you're nodding. So if someone isn't a UW student, the expectation is that the mentor would be the official submitter of the IRB application. There's a lot of
I think
nodding.
it would have to be, assuming that the organization doesn't have some other IRB to submit under. which I assume they wouldn't. If
Mhm.
they did, Susan, maybe you can help with the regulatory side of it. If they did have some other IRB that they submit through, it wouldn't have to go through the UW IRB, would it?
Joanne might know better, because I actually don't have a lot of occasion to delve into these kind of rules, but from in the past, as far as I know, because the funding is at the university, then it would either have to be a university IRB review, or if it were a different organization that has their own and it was acceptable to the university to take their the other organization's IRB review, then that would work. The only one I know of that has some sort of reciprocal agreement is between the university and Fred Hutch. So yeah, probably the likely scenario would be a University of Washington IRB approval.
Yeah, the only other one I know of is WERB, if it's still called that, which is the multiple organization IRB, but that is quite costly, and I can't imagine that that's what any of these projects would go towards. Okay, thank you.
Mhm.